The role of ramucirumab in gastric cancer is very interesting, especially compared to some of the VEGF drugs that haven't been as successful. And as we know, ramucirumab is approved in both first and second line metastatic disease for gastric cancer. So in this study, the idea was to combine ramucirumab with a 3-drug chemo regimen, the FLOT regimen, as preoperative therapy for patients who will undergo resection for gastric cancer. So the questions of this this presentation were really the pathologic CR rate and the toxicity. So as it turns out, it did not seem to increase the pathologic CR rate, and there were a few more surgical complications, as may be expected when you give an anti-VEGF preoperatively, but those seem to be confined primarily to the sewer type 1 patients, the ones who are really up at the GE junction and who have more complications and perhaps more post-operative surgical complications. So if you limit those and you're dealing more with the body and distal gastric cancers, there may be a role for ramucirumab here. In those patients who seem to be equally safe, and there is definitely a shift in the staging away from T4 to earlier stages. So even though the PCR rate may not have been particularly higher, it seems like there was downstaging with ramucirumab. And it'll be interesting to see how this evolves with more data on PFS and OS, and you eliminate the GE junction tumors.